Hello, I'm Autumn, and today I'm going to be a veterinary technician and I'm going to talk to you about demodicosis. What is demodicosis? It's also known as Demodex mange, Demodex, and red mange. What causes it? A mite that lives in the hair follicles. Most dogs and humans actually have this mite. When the immune system is functioning properly, it causes no harm. So when the immune system isn't functioning properly, the dogs will begin to lose hair. It's not necessarily severely itchy for the dogs, but it does result in hair loss. Hair loss typically will begin around the eyes. Who is susceptible? When dogs are from 12 to 18 months of age, their immune system isn't fully mature, and then as the dogs get older, their immune system will start to decline, resulting in these dogs being the most susceptible. So if you happen to be a dog breeder, and your puppies come out with Demodex, you will not want to breed the parents of the litter or the puppies within the litter because it is a genetic defect. It's transmitted from the pup to the mom within the first few days of life. Is it contagious? No. What does it look like? So as you can see here, the dog has a generalized form, which I will talk about in a little bit. It's all over its body, it's down its abdomen, all over its legs, and as you can see, there is some hair loss from around the eye. Under a microscope, so it looks like a cigar-shaped mite, and it has 8 legs. Are there different classifications? Yes, as I talked about earlier, you have the generalized, which is where it spreads all over the whole body, and localized, where it will only be a few patches here and there throughout the body. How is it diagnosed? We will do a deep skin scrape. So this is our dog, Joey. So typically you'll be doing this on a dog that has demodectic mange. Fortunately, my dog does not, but I'm going to be showing you the techniques and how to perform the deep skin scrape. So you're going to take your scalpel blade and your slide is going to already have mineral oil on it. So you're going to just put your scalpel blade into the mineral oil so that your Demodex will stick to your scalpel. Then you're going to go to the bald spot on your patient and you're going to just work up and pinch the skin so that you're working the Demodex up and out of the hair follicle. Then you will just start scraping, making sure you're holding your blade parallel to the patients so you don't cut them. And you're just going to scrape like so until your skin is getting irritated and is just going to start to bleed. This means you have gone deep enough and you do not want to go any deeper than this. Then you're just going to take your scalpel and you're just going to rub it off onto the slide and ensure that there's no hair clumps. If you have hair clumps on there, you're going to want to spread them apart so it's easier to see under a microscope. So there are different types of treatment that you can do depending on whether you have the localized or the generalized mange. Treatment can include topical, oral, or injections. So the topical treatment, you use a topical medication on localized demodectic mange, as you don't have to treat the whole body for it. But if your pet has the generalized demodectic mange, you'll use shampoo, dips, and oral medication as it is a more severe case. So for the generalized, you're going to have to be washing it with a medicated shampoo that contains benzoyl peroxide. Basically, the benzoyl peroxide will flush out and open up the follicles prior to doing the dipping method. Orally, you'll be giving merbinocin oxamine. So the dipping can have some serious side effects if it is not diluted properly or used incorrectly. So the dipping has an insecticide called Demodicosis. In dogs, the side effects can include vomiting and sedation for about 24 to 36 hours. Most time this will resolve on its own though without needing medical intervention. If your dog does react, you're going to want to dilute the dipping with 25% more water. So after about 2 to 3 dips in 7-day intervals, we're going to repeat the skin scraping to see if the Demodex is resolving, as we cannot tell because the Demodex is within the hair follicles, so we're going to have to repeat the skin scraping to ensure that the Demodex is being flushed out. For the localized Demodex treatment, you're using a topical medication, so you will be applying it to the bald spot. So you will take your prescribed amount of topical medication on your finger and just apply it to where the mange is. For the shampoos, you're going to apply it everywhere. Since it is generalized, they have it all over their body. You're not just going to do the little spot treatments as if it was localized. You're going to allow this to sit for a specific amount of time. Then you're going to apply your dipping method, which contains the insecticide amitraz. So you're going to want to make sure you dilute this properly for your dog, so that they're not having those serious side effects. This is more like a flea treatment for them to help kill off the Demodex mange. You're going to want to do this until your dog has 2 successive skin scrapes in a row. To apply the dip, you're going to apply it just as you would with your shampoo. For the prognosis, it's good, but if they have a too weakened immune system, they may not respond. If they do respond, they can relapse within 3 to 6 months after the final treatment. So you're going to want to keep an eye on that. Generalized treatment will take a long time because it requires regular skin scraping. There's a lot more Demodex mange to try and resolve.